Hi, I'm Dr. Suzanne Turner. I have a concierge family medicine practice in Alpharetta, Georgia. This is my dear friend, Ellie Campbell, and she has a concierge family medicine practice up in Cumming, Georgia. We're both outside of Atlanta, about 15 or 20 minutes. And we are friends. She's my doctor too. And
she's my idol.
And we're just coming to talk to you guys today, especially to our concierge partners, about what we're doing and how we're dealing with this COVID, because we're seeing so many patients now. We're just coming to talk to you about how we're dealing with this and our woes and our triumphs, and how 2021 is going to be a better year for us.
Absolutely. So many of you may have already experienced a big surge in COVID. Here in Atlanta, we hadn't seen it much until the last 2 weeks or so. And now COVID is surging. It's actually almost to a DEF-CON situation in our local hospitals and emergency rooms. They're on diversion for medical care, for emergency room, for ICU care. Some hospital ambulances are having to go up to Kentucky to take patients because there's just no beds at the inn. Which means we as primary care providers have an opportunity and an obligation to do everything that we can to keep our patients strong and healthy. And as integrative doctors, Suzanne and I both, we have many tips and tricks to share that I think are valuable. Both of us take nutritional supplementation as preventives. I take vitamin D, A, E, K, all the fat solubles at very high doses. I take NAC, N-acetylcysteine. I take zinc. I take quercetin. I take, I'm trying to think what else is, a multivitamin, and a fish oil, omega-3. I think that's my daily supplement stuff that I've been taking since COVID. How about you, Doc? What are you taking?
I was going to ask you, are you doing any Myers cocktails yourself?
I have been doing Myers probably about every 2 weeks. I'll take a high dose vitamin C. I'll take up to 25 grams. If there's been somebody in the office that's had COVID, then that day or the next day, I'll take a 25 gram vitamin C. Otherwise, I'll just do a Myers maybe twice a month.
How are you doing with exercise right now? It's January and cold.
Yeah. So it's cold, but in Georgia, that's not terrible. We had a beautiful weekend. I hiked Amicalola Falls and Indian Seats here in Cumming. I had my husband and sister were here, and so we walked all the way up the mountain and then all the way back down again. Actually, we did the other way because there was no parking at Amicalola. It was so busy. So we walked 725 steps down and then all the way back up again.
Nice.
So yeah, that's my favorite thing is outside. I have 200-pound puppies. So walks with my dogs is exercise, upper body as well as lower body.
Mm-hmm.
And you're an exercise fanatic, so that's where your happy place is. So I know you're getting plenty of exercise. Sleep is also critical for me. It's always been my best wellness strategy, and I spend 7 to 8 hours every night. A short night of sleep for me is 7 hours. So,
do you use anything to track your sleep?
I don't use any apps or anything. I have mild sleep apnea, and so I'm wearing an oral DNA device, and I tape my mouth closed at night. So I use micropore tape to literally tape my mouth closed, so that because this device is just a little bit large and it's hard to keep my lips closed around it. And we know that you must sleep with your mouth closed. Noses are for breathing, mouths are for eating. And if you're not breathing through your nose, you're not getting adequate nitric oxide, which we know is a critical pathway for managing COVID. So I want to always breathe through my nose, and mouth taping helps me do that.
Like I know you are, I'm a measurer. So I have an Oura Ring and I have a sleep number bed, and both of those measure my sleep. They give me different results. So I'm trying to sort of figure out what that is. But And then I'm doing, I do a HIIT for a 4-minute HIIT exercise. And then I do either a weight training class or a Tabata class 3 or 4 days a week. And I'm like you, trying to set aside and make a priority of 7 to 8 hours of sleep, trying to make that set boundaries with my life so that I get a 7 to 8 hours of sleep every night. And all of these, the reason we're mentioning these is, yeah, you can take all these supplements, but if you're not doing the things that are going to be healthy for your body, then all of this is pointless.
Right, because we think that one of the drivers of chronic illness and one of the contributors to poor outcomes with COVID is high levels of oxidative stress. Mm-hmm. So we want to do everything that we can in our lifestyle to get our own levels of oxidative stress down. And that is supplements with antioxidants, but it's also sleeping and resting and meditating. I have an app on my phone. Every morning after I wake up, I start the coffee and then I go sit and do my meditation, usually with a puppy on each side. And so that's, for me, that's how I start my day. And we know that these self-help strategies make huge improvements in your resilience and your ability to fight something should you catch it. So
managing emotions is really important right now. We underestimate the contribution of that to our oxidative stress. When you are under a high amount of stress, that emotional stress can affect your DNA and your protein synthesis, causing lots of problems, making you more susceptible to illness from COVID. So, for example, naming your very frustrating things that are happening right now, allowing yourself to feel sad about them or to feel angry about them, journaling or whatever the things are, finding therapists. We have several therapists around here who are doing Zoom meetings with patients. So figuring out a way that you can express that emotion so that you're not holding on to it and creating more of a problem that virus is just going to jump in and take care and take over.
And it is frustrating. I mean, here we are, primary care doctors in the trenches. Neither you nor I are connected in any way to a hospital. We're not seeing hospital patients anymore. So our ability to get the supplies that we need, the basic PPE, is limited. We were told by our rep recently when we tried to reorder N95 masks that we weren't eligible because we weren't considered frontline healthcare workers.
Right.
Well, I don't know what else is healthcare. We're doing COVID testing in our office. We're giving IV to COVID patients in our office. We're, taking care of them both remotely and face-to-face. And so after some conversation, they acquiesced and decided to give us a little bit of supply. So we've got some coming in to replace our very dwindling supply. We've never had proper fit testing. We're not hospital employees. So we do the best that we can with what we have. But these are frustrations. And,
Right.
I tell my staff all the time, it's like driving a car. I don't have any chronic illness. I take no prescription medications. What a blessing, right?
Mm.
So except for my hormone cream, I guess that is a prescription, but it's not oral. And so I don't take any medicine. So the number one most likely thing to kill me is a car accident, but I still drive my car to work every day. Mm-hmm. Right. And I drive it on a very busy accident prone road. So what do? I mitigate my risks. I don't text and drive. I buy a car that has good safety record. I make sure that the airbags are in working order. I wear my seatbelt every day, right? I am aware of my surroundings when I drive. I'm a good driver. I've never caused an accident. So I mitigate my risk. It doesn't go away, but it's less. And so we do the same for COVID. We can't make our risk zero, but we can reduce it. And all these self-help things make a huge difference.
Right. My protocol is a little bit different. I'm a big believer in ketone esters, so I definitely include that in my armamentarium. We know that ketone esters will recycle all of your antioxidants. And so because I'm going to take it a couple of times a day, I use the ketone ester as opposed to the ketone salt. They're a little more expensive, but I think the difference is worth it. I can only use the ketone salt once a day. The ketone ester I can use multiple times a day. And so I'm doing that because I'm exposed every day. I can't tell you how many patients have come in the office, not said a word about their symptoms, even though it says on the door, hey, don't come in here if you have symptoms. Or call us ahead of time if you have symptoms, so that we'll bring you in a different door and gown and glove up if we can. And so we are trying to take care of those patients as best we can in the office. And we're seeing them physically. I'm sure other concierge doctors, private doctors, are seeing patients in their office just like we are. And trying to navigate your staff mood and all that's been a little tough. But we actually have one girl who caught COVID fairly early in the spring, and she's the one who continues to volunteer to be the IV person. So we're unfortunately blessed with that she would be willing to do that. And then my nurse, who's been with me for 11 years, is also outstanding and has also been doing a lot of the therapies. Yesterday, she was in a nebulizer room with a patient who had COVID. So we're navigating the best we can. We get our PPE off of Amazon just like everybody else. We ran out of gloves a couple months ago and had to order the lunch lady gloves. You know what I'm talking about?
Yeah.
And we were using those to clean rooms, because you got to have gloves to clean rooms because you don't want to get exposed to all those toxins. So it's been a little bit of a challenge, but I'm using the ketone esters. Those are helping to recycle all your antioxidants, decreasing your load of your oxidative stress, and turning on that autophagy, turning on NRF1, so that you're turning on the ability of the cell to clean itself out, especially if we're talking about cleaning out cells that contain any of that COVID. And then I'm also using baking soda or Alka-Seltzer Gold is my preference, just because it's easy. I use that every day because we know that the virus has difficulty replicating inside the lysosome if it's in an alkaline environment, and that's just enough alkaline to allow you to, because of my workouts and what I do for exercise, I take a fairly high protein diet. So I need the extra alkalinization. And so that's what I'm using that for. Most of my patients probably don't eat enough vegetables. And so most of them, I'm telling, without a doubt, please make sure that you're taking either baking soda or Alka-Seltzer Gold if you can find it. That we know can be really helpful in limiting the replication. And then I'm trying to think of anything else that I'm taking specifically for COVID. I take.
Are there any peptides specifically?
Yeah, I take a couple peptides. I take. There's one called thymosin alpha-1 that has 3, I think now, huge, large-scale studies in COVID patients showing benefit. So we're pretty excited. We in the peptide community are pretty excited about COVID because it's allowed the opportunity to have these big research studies and say, look at how great this thing is. It was already approved for treatment of hepatitis C, and now we've got evidence that it's beneficial against it. So that's what I'm taking.
Is it helpful for prophylaxis that we know of, or just for treatment?
Well, the research is just in treatment, but because of the way it works, we know that it works on that immunosenescence that can occur over about age 35, unfortunately. Decreasing thymus gland helps with the thymus gland to not be fat replaced with fat. And so as you age, your thymus gland that produces all your immune fighting cells, or at least the first line, we know that that's helping to prevent. So that's what I'm starting with. So I'm on that. And then we traveled a couple times this year. And so before we traveled, I took a shot called pentosan polysulfate. Pentosan helps with the whole iron hepcidin issue that's happening that we think is related to why people are having heart attacks and strokes post-COVID. And so it lasts 4 or 5 days. So I took a shot right before I left on my trip to help, just in case I was exposed on the trip, and help keep that from happening.
Awesome. Yeah, this is a big month for me. This is my month of my 60th birthday.
Oh,
so
birthday.
Yeah, thanks. So far, so good. We just want to get this COVID stuff behind us so we can focus on other things, because everybody's tired of it.
Yeah.
But we still play our part as members of our society. We try to socially distance or physically distance where we can. We wash our hands multiple times a day. We wear our masks when we're out and about. I think these things are still foundational. And while they're controversial in some sectors, I think the evidence is quite profound that they matter.
So there was a fascinating article that came out about 2 months ago that showed that the masks don't prevent transmission, but they do increase the asymptomatic rate. So how awesome is that, that you will increase how often you are asymptomatic? The second thing that this article showed was a decrease in transmission of the flu by 65%, which is better than the flu shot.
Right.
That was pretty good. I was pretty excited about that.
Yeah. So, all right, my dear. Well, I think that kind of sums up both your and my experience to date. We'll get more experience as time goes by, I'm sure. And as the virus, there's antigenic drift, right? It's going to shift and change. All viruses are shapeshifters, and they'll all show themselves to be a little bit different later in the season or next season. And we may have new tricks that work better, or we may have new things to share. But for now, we hope you find this little tidbits helpful. And both Dr. Turner and I are able to answer any questions that you have. We will put at the bottom of the show notes the East Virginia Medical School math protocol. I think a lot of docs are, including myself, are following that with really good results, because we started the talk with what are our wins. My big win is in my entire practice, I had 1 hospitalization and 0 deaths. Mm-hmm. I think that's a huge win. Our only hospitalization was somebody who gets hospitalized all the time for everything all the time, including other viral illnesses. So that was a rarity, but everybody else is doing great. And I'm sure your statistics are very similar, right? Mm-hmm. So that's the best news of all.
Yeah. Thank you, Ellie. I appreciate you today taking the time.
I appreciate you.